Good afternoon, everyone. Thank you for joining on this Friday afternoon, March 12th. We're so appreciative of you making the time as we now have come to the year point of the pandemic. We are here today with one of our deputy health officers for Contra Costa County, Dr. Sarah Levin. As you know, Sarah has been our guiding force through the last 12 months, has immersed herself in the work of long-term care, and is going to talk to us today about the updated guidance released by CMS and CDPH this week as it relates to visitors. I want to remind everyone that Department of Social Services has not yet released their guidance. So what we're talking about today largely pertains to skilled nursing facilities. However, for you RCFEs and ARFs, it is a great time to start preparing your guidance for what this is going to look like for your facilities. Also want to remind everyone that this is a safe place to ask all kinds of questions. You can do that in both the chat and the Q&A. We will provide the recording to everyone who registered next week, so you can refer back to it and share it with staff and colleagues in Contra Costa County. We also want to remind everyone that we will be doing a webinar next week for families of Contra Costa long-term care facilities. So if you have families, I will share the link with everyone. Please encourage them to register. We know that it's not just a matter of you creating policies and procedures, but we also want to update families on their questions, and we want to support you in that effort. So with that, I'm going to turn it over to Dr. Levin. Dr. Levin, thank you so much.
Thank you, Nicole. Thanks for the introduction and the hosting of this webinar. I just wanted to, Nicole and I talked about doing this on Wednesday. Sorry it was such late notice, but felt like we were already fielding a lot of questions about the changes in the both the visitation policies and the visitation guidance coming from CDC, from CMS, from CDPH, and as well as how it pertains to changes in quarantines. So I'm going to try and go through the basics of what changed, and then I'm going to really leave the majority of it for Q&A. I know I was on the calls this week that I know some of you participate in, the state calls, and heard as well a lot of questions that even have changed in the last couple of days. Let me tell you from the Contra Costa Health Department's perspective, what we have done and what we are following in our latest update of our guidance document, the long-term care facilities instructions on visitation and quarantine of staff residents after vaccination and exposure. We, in the last 2 weeks, I just want to first say we did rescind our health orders that we had issued earlier in 2020 regarding the testing policies, as well as the visitation and gathering, communal activities and dining at facilities, because we felt that there was really no added value at this point. When we issued those, that was in the context of a vacuum of guidance from your regulatory agencies. And now that those are robust and clear, we didn't feel that we needed to continue with that as a health department any longer. Really wanted to move back into what our true position is as a local health department, which is providing support and guidance and counseling rather than imposing regulations. So I just want to make sure everyone's aware of that. What we are continuing to issue in terms of our guidance is coming from what was last updated on Wednesday evening, the CDC visitation guidance. I know that many of you may have been getting questions from families reading the CDC guidance for the general public, which says that fully vaccinated people, meaning that you're 2 weeks out from your second dose of a 2-dose series, which would be the Moderna or Pfizer, or you're 2 weeks out from the 1-dose series of the Janssen, is fully vaccinated. That fully vaccinated people can now gather indoors without masks. That was the guidance given to the general public, which is not the guidance from the CDC for what they're including long-term care facility, assisted living facilities and board and cares in, they're calling healthcare settings. So I just want you to know that if your families are going to the sites and looking at the CDC guidance, it's really important that they look at the guidance that's about visitation in long-term care facilities and healthcare settings, which is essentially in alignment with what the CMS guidance is and what the AFL that came out this week from CDPH is for nursing homes. So we are following that, and as Nicole said, in absence of a PIN yet from DSS, so aligning the guidance that we are giving to long-term care facilities that includes the AFLs and board and cares with that SNF guidance and what CDC is calling the healthcare settings. So the changes that have been made are that indoor visitation is now allowed with what they're calling brief close contact between fully vaccinated resident and visitor in in-room visitation. But that is caveated with that they should still be masked with a fit tight, not a fit tested, but a tight fitting mask, a well-fitted mask during that contact, and should maintain social distancing as for the visit as much as possible. So that is, there was a caveat in the state guidance that said the purple tier did require that the visitor, regardless of vaccination status, would be tested within 2 days prior to visiting. However, I am really excited to announce that we are going to be in red tier on Sunday. If any of you have not heard that news, it just came out today that the California met the 2 million testing mark for our most highly impacted residents. And because we met that mark, they changed the tiering status. So now we are, they're going to retroactively apply it on, as of Sunday, we will be in the red tier. So that will, as long as we stay in the red tier, that will no longer be a requirement. I know that was causing some concerns, practicalities, concerns around having visitors tested. So like I said, it is now that the visitation is allowed indoor, in room for all residents, but that the fully vaccinated residents and fully vaccinated visitors can have brief physical contact. The caveats that they did put into the CDC guidance around indoor visitation for residents was that indoor visitation for unvaccinated residents should be limited if you're in a facility where there is greater, if you're in a facility where less than 70% of residents are fully vaccinated, or if you're in a county where there's a greater than 10% positivity rate in the county. We are now down to a 2.3% positivity rate in our county. So, and almost all of our facilities are well over the 90% of the residents are vaccinated. So I do not think that's going to apply, and I hope it will not apply anytime in the future for us. That given that's the caveat, for indoor visitation, there shouldn't be a limit on indoor visitation should be permitted for all residents. The only other caveat is that facilities that are in outbreak status need to follow the CMS guidance about and the CDPH guidance about outbreak status in terms of limitation of visits to either residents that are in quarantine or to units that are in quarantine. And obviously, similar to what many of you have been through with us, those initial stages of an outbreak, they may shut to visitation during those if you're doing the initial investigation to assess the extent of the outbreak. That is the changes to the visitation policies based on vaccination status. The other changes that were made regarding quarantine based on vaccination status is that the recommendation now from CDC is that healthcare workers who are fully vaccinated and have a known exposure, do not need to quarantine from work any longer. They need to continue to follow the same symptom monitoring and screening and testing procedures, but they are not, it's not a recommendation anymore that they need to quarantine from their work for that 14-day period. Before we had said that, continued that, and allowed them to come back to work if they remained asymptomatic and there was a staffing crisis, but that caveat is not there anymore. Fully vaccinated staff who have a known exposure can continue to work with adequate symptom monitoring, screening, and testing as before. For fully vaccinated residents, however, they still do need to be quarantined, and this is being recommended across congregate settings. So if you have a full resident who did have a exposure of more than 15 minutes within less than 6 feet of a known COVID positive patient, then they would need to go into quarantine status, okay? And that means, again, they would not be allowed to have visitors in the indoor visitation. That remains in place for them. The thing that has changed for residents in the guidance is that new admits to facilities that do not have a known exposure can be admitted to the facility without that initial quarantine. So if you are admitting new residents that do not have a known exposure or risk, have a low risk for exposure, and that may be something that you as a facility need to assess on a case-by-case basis, because you are largely potentially going to be relying on the information that you are receiving from that resident's family. You'll have for new admits that are coming from another setting, you may have more full information, reliable information. But so that could be a game changer for your new admissions, not having to require that quarantine initially. Those are the major changes that I have gotten questions about and heard from you about, but I'm sure there's lots more that I haven't addressed. This was just sort of a broad overview, so I would like to open it up at this point for questions. We will have posted by the end of the day on our Congregate Living Facility webpage our guidance documents from Contra Costa County Health Department that are really just trying to bring out the salient points from the CDC guidance and the CMS and the AFL guidance. So,
Dr. Levin, thank you so much. Are you ready for questions?
Yeah.
We have a lot of questions. I want to encourage everyone to add them to the chat, add them to the Q&A. This is a safe space to ask anything and everything. So The first thing we have is, are you still recommending surveillance testing? Should facilities still be engaging in that kind of behavior?
Yes, so there has not been any change to the recommendations for surveillance testing. So that is still in place.
And can you just go over, maybe quickly, just remind us of what those standards are for each of the facilities types?
Yeah, so for the skilled nursing facilities, their requirement is weekly testing of the healthcare personnel. And if the county positivity rate is less than 10%, if it goes over 10%, then it's twice weekly testing of healthcare personnel. And then during an outbreak, testing weekly of all healthcare personnel, all residents, until there's 2 cycles with no positive COVID tests. So the response-driven testing.
Okay.
The response-driven, now there are cases where it will be an isolated staff member or unit where that first positivity, and then there's a limited testing plan that is agreed upon with the public health investigator. And I know many of you have been in that position. That's the blanket overall guidance from the state for SNFs and the testing frequency. And then we're allowed as the public health department to make modifications to the breadth of that testing in conversation with the facilities. The assisted living facilities, the residential care facilities for the elderly, their regulatory guidance is that they have to test at least once monthly of all healthcare personnel on a sort of rolling basis at about rate of about 25% per week to cover monthly screening for all healthcare personnel. And then the response-driven testing is exactly the same, is that once you do have an outbreak status, a positive case in a resident, or 2 or more staff with positive cases, then you go into outbreaks response-driven testing. I do want to note that we had at one point said that any one staff or any one staff would launch into outbreak status with initiating response-driven testing and shutting down visitation. We have raised that threshold for assisted living facilities, residential care facilities, it has to be 2 staff before we launch into that.
Okay, thank you. So, indoors can mean a lot of different things to different people. And so I wonder if we could talk about this idea of, is indoor visits, does that mean in the resident's room, or does that mean in the dining room, like a large common area? What should facilities be thinking of along those lines?
Yes, so the guidance is really still that the safest is outdoor. So if that's possible, to sort of have a prioritization of the safety of the visits, and to always follow the core infection control principles in this, which include the physical distancing, masking, good ventilation, hand washing and hygiene before and after, if movement from either because there's physical contact or moving from places. So indoor, so preference number 1 on the hierarchy is safest is outdoor visitation, maintaining all those core principles. Number 2, safety is indoor in a larger communal space where there is good ventilation, and where there's maintenance of ability to easily maintain 6 feet of physical distancing during the visit, and to minimize the number within that space, the bodies in that space. So there's been, they're not getting into the fine details of like how many square, calculation by square footage, and that's how many you could allow, but really encouraging, trying to have scheduled and limited visits in order to allow everyone to both have visitors and to maintain that social distancing. And then the third is the in-room indoor visitation. And so that was where there was more restrictions around, which is, ideally, if they have a roommate, then that the visit doesn't occur there, or the roommate is out of the room when the visit occurs in the room. That is the context in which you would have fully vaccinated visitor and fully vaccinated resident being able to have brief physical contact, that they now there's not the visitor doesn't have to be fully vaccinated to do an in-room visitation, but if they are not fully vaccinated, then they have to maintain distance in the in-room visitation, and that physical contact is not allowed. So that would be the difference there.
Okay. So I want to maybe sort of recap what I think I hear you saying and the policy demonstrating, and then I want to dive into that a little more.
Sure.
So we acknowledge that we're going to have visitors, but it's not exactly like the old days where people can come and go all the time, that the facility should be putting procedures in place to have as much access as possible, but is still likely going to need to be kind of scheduling a little bit. It's not like every Saturday, 30 people are in there at the same time. You might have to work with families to say, okay, what time can you do? What time can you do? So they're not all in the dining room at the same time.
Right. Yeah. And I think, Nicole, you bring up a real good practical point, which is like, I think for each facility, I think you need to look at what your indoor common space where you're going to have, or, where you're doing visitations, and how many you think is appropriate at a given time. And then maybe you have a calendar, and in order to visit, people really do have to sign up, for a schedule, because you can only have, however many 5 visitors per hour for a 30-minute visit, whatever limitations you put around it, but a schedule that makes sense, that allows for adequate physical distancing, that, they obviously, all the initial screening has to take place. For the visitors before they enter the facility. I think that makes a lot of sense, and it's going to be different for different facilities given their space. And so some may say that, they really can only have, indoor in-room visitation, and outdoor visitation, depending on what your space is. But you do have to be able to accommodate for some indoor visitation.
Mm-hmm. And also, as I read the guidance, it was specifically that if it's sort of end of life or compassionate visits, those have to be allowed in rooms they have to accommodate that no matter the parameters, right?
No matter, right. So that right, the compassionate care visits, which has a much broader scope, which includes, residents who need help with cueing, grooming because of their emotional well-being and health, that even if it's outbreak status, that's a go. You can't deny those. You do want to use, and part of the guidelines too is that the visitor needs, and we've provided this to you, should be informed and consent to that they understand the risks that they may be taking if they are coming on a compassionate care visit in the context of an outbreak.
Excellent. So you mentioned a little bit in here around like the resident being fully vaccinated and the visitor being fully vaccinated. So how can the facility know if the family's vaccine is legit? They know their residents, what's happened. They're trying to still protect everyone. How can they ensure authenticity?
Yeah. So this was a question too that came up on the call on Tuesday. There isn't any regulatory language around this, so they're sort of leaving it up to the facilities to set their policy. But I think it's reasonable to say that everybody's getting the same CDC card when they get their vaccine. So I think you should feel like you can make that if they want to participate in the activities, which is the physical contact with residents, that they are able to show that proof of vaccination.
Okay. So no one can say, oh, I know my vaccine site didn't give those cards. Like that's not legit, right? We all know that for Pfizer and Moderna, they should have 2 indications on there. If it's the more recent Johnson & Johnson, it's just going to have 1 entry on the vaccine card. Great. Okay.
And, if there really is something where they lost their card or something and they want to show it, that they can get a print. It all goes into the California Immunization Registry database.
Mhm.
So they should be able to get proof from their provider of their immunization status, just like we have to do when we, sign up for schools or go to work.
Yeah, good point. So part of the residential experience is not that you're always there, right? You get to come and go. And oftentimes residents like to go out to the family's home for dinner or to spend overnight. What are the restrictions around that? Is a resident just able to go wherever again? Are the doors flung open? Is there some best practices around that?
Yeah. So we are saying in our guidance document that if the residents do a non-essential outing, which we know many are, and they are in a household where not everyone is fully vaccinated, then when they return, they should be in quarantine. So that's the guidance we are giving at this point. But we took away, before we were saying that everybody, regardless of the vaccination status who did a non-essential outing and overnight would have to be in a 14-day quarantine upon return. So this may put, again, more of a burden on the facilities to, decide how they're going to verify that, or that they're going to, they're going to trust these families and the residents to be responsible and being truthful about that. But that's the guidance that we did change as well in our, I don't know if people remember, but we did a little tier that of visitation and return to facility, return to facility and quarantine by county tier status.
Okay. So when they're taking in new residents, should those new residents still go into the yellow zone, or can they go, because you talked about, new admissions, if they don't have it, if we don't know they had an exposure, they can go anywhere. That means they can go into the green zone immediately?
If they're fully vaccinated.
Okay, but only if they're fully vaccinated. If they're not, and they still need to get the vaccine through the facility, they should go to the yellow zone.
Correct.
Okay.
Yep. So only fully vaccinated do not need to be put on a quarantine at new admission. Okay. And if they did have an exposure, or there's a question of possible exposure, they were in, they were in multiple households, even, and we're still in the red tier, then that may be, that is within the realm of the facility to say we want to keep them in a quarantine status.
Mm-hmm. So if so many of us have been vaccinated, thankfully, the staff, the residents, if a new admit is not yet vaccinated, we're of course going to add them to our normal testing schedule, right?
Mm-hmm.
Okay, until they would be. Great.
Yeah.
So some residents, they have a caregiver, what's sometimes called a sitter, and they stay with them, throughout the day. Does that person still need to maintain 6-foot distance, or can they engage in some physical contact? Something that helps to keep resident calm.
Yes, so they're fully vaccinated.
Yeah, let's assume that the sitter they're not allowed, because they're a caregiver, so they've been fully vaccinated. The resident's been fully vaccinated, but they're there to provide sort of supervision and comfort throughout the day.
Yeah. Yeah. So I think, they use this language in the AFL and in the CMS and of brief physical contact, such as a brief hug, feeding, grooming, activities that clearly are not brief. So I think that that's confusing. But I think the intent of it is saying this is a much safer activity, a lower risk activity with fully vaccinated. And so now we are acknowledging that there can be close contact and physical contact, but with still maintaining masks and frequent hand hygiene after those activities of physical contact.
So like when those families come in, everyone's been vaccinated, they've verified that, they want to hold Nana's hand, they want to give her a quick kiss on the cheek. They should still be wearing face masks and maybe face shields also, and still, sanitizing their hands and all of those things, right?
Right.
Okay.
Yeah. They did not say face shields. And I think that was in somewhat purposeful, just because I think the face shields is really more in the PPE structure of the healthcare personnel that are, multiple close contacts throughout the day, going with multiple residents and
Okay.
patients.
So
But it was definitely distinct from what the CDC guidance was for the general public, which is like, if you're fully vaccinated, then you can be indoors unmasked, which is not the guidance that's being given for these settings.
right. So how does this impact sort of community activities in the building? Say, for example, dining. Can we now return to a normal distance between residents and the dining table, or are they still, 6 to 10 feet apart?
They're still 6 to 10 feet apart, is still the recommendation, and that they maintain masks while not eating or drinking, sort of similar to what's being maintained in the general public restaurant world. I know this is a closed environment, but that is still the guidance.
Okay. So in addition to dining, are they allowed to do group activities again, such as, I'm thinking like chair aerobics, where they're apart and they're wearing their masks? Can they engage in those activities again?
Yes.
Okay.
As long as they are not in a outbreak status.
Mm-hmm. And I would and so tell me what you think about this, Dr. Levin. I'm also assuming, of course, folks who are in the red or the yellow zone, you're not going to cross zones, if you will. Make sure you're doing activities for the folks in the green zone and a different set for the folks in the yellow zone, a different set for folks in the red zone, making sure you're not merging those.
Yeah, definitely. And and to be honest, we all know that that in some of the facilities, especially the memory care units, maintaining all this is quite challenging and difficult and not possible in cases. So as much as you can to, where there may not necessarily be clear green and yellow zones, but like to then even have cohorts, right? So it's always these, this group together and this group so at least there's some ability, should there be a case or an outbreak of they'd had some natural smaller cohorting.
Mm-hmm. Okay. So this leads us, I think, down a really, interesting path. You said the O word before, which is outbreak. So are we still operating under the guidance of one staff member triggers an outbreak status?
Yeah, so we did change that last week to saying, bumping it up to two staff. One resident always triggers an outbreak status, so that remains. Mm-hmm. One resident, one patient. But we have upped the number to 2. I'm advocating that we go up to 3. Given that we're seeing quite a bit is that it's now it's mostly unvaccinated staff members acquiring from the community. Okay. So but that even one staff still does trigger the testing of there might be a brief, a brief closure, similar to what we've been doing, where everyone gets, who's had contact with that staff member gets tested to assure that that is the only one and that was a community acquisition.
Okay. So I'd like to talk a little bit about the interplay between hospitals and facilities. So what if how does we've said you don't have to quarantine if certain scenarios, you do if certain scenarios. How does this interplay if someone's gone to a hospital? Does that trigger it? Maybe we don't have a known exposure, but it was a hospital, so it's a little more open, so they should automatically quarantine. What if someone's coming from a skilled nursing facility to a residential care facility? How does that work? Well, how should we think of these healthcare settings?
Yeah, we are not saying that if they're coming from a closed setting, so a hospital, a skilled nursing facility, a clinic visit, a dialysis center, we are not saying that return to facility or transfer to facility from those settings should not trigger a quarantine of that returning resident unless they were informed by that facility that there was an outbreak. It is a requirement of those facilities to inform them upon transferring if there is any risk of exposure or an ongoing outbreak. So,
all right, that's complicated, but I hear the point you're making.
so
I'm
it's
sorry,
the obligation of the transferring facility to make clear that they do not have any known exposure.
okay.
And there's no requirement on the receiving facility to put them in quarantine if they don't hear that.
But the period of time they spent in the hospital would not count towards an isolation.
So the period of time that they spent in the hospital, so now that we're saying that fully vaccinated do not have to be quarantined upon admission, new admission, if that person is coming from the hospital, they don't need to be put into quarantine. If they're not fully vaccinated, it's the same as before, which is if they were in the hospital, those hospital days can count as part of the 14 days of the quarantine upon admission to the facility.
Okay. So I just had someone email me a question. This is great, which is essentially, staff are, we're opening up. They're going to start going places. They might go on vacation now. When a staff member comes back, what should the facility require before they come back on duty?
So definitely testing, right, within that that regulatory testing. So weekly for SNFs and monthly for assisted living facilities. They don't have to, of course, using your standard symptom screening and infection prevention and control basic measures always, but essentially before they start work again, they would be expected to test and test negative and then continue to do symptom monitoring. But right now, unless they are coming from a place that is where they had an exposure or where they're at high risk, there's not a quarantine imposed.
Okay. So, as you said, we're going into red tier on Sunday, and we've been in purple tier for a while, and we've been able to do some things like nails and hair. And, residents like to do those same things. They like to leave to enjoy the same services you and I do, like a restaurant or a hair salon. You talked about this before, but can you really dive into when someone's gone for a couple hours to get a service? How should that be handled? Because I still get to go back to my house and no one kicks me out, right? No one makes me lock up for 2 weeks. How does this interface with residents?
Yeah. So, so we are not imposing, ideally it's, it's counted in that same category of the non-essential outing. So they do not have to, upon return, quarantine if there was no known exposure and all those precautions were maintained along the lines of the community guidance. I think we still have a preference, as I am suspecting the facility managers do as well, that those barbers and hair stylists and pedicurists, manicurists that are doing those services preferably are people that you're having come into the facility to provide those services for your residents, such that there's more verification and control over those practices, and that certainly is the expectation, is that they will follow and use all the same infection prevention and control procedures that we are asking all personnel to.
Okay. I just want to say, for me, the nails has been essential, but I understand what you're saying. We have some really important questions coming about staff now that they're able to travel internationally, going to other countries and other states for a vacation or to visit family or whatever that looks like. Talk about that international travel. Is it any different from the answer you gave before, particularly for clinical staff, like folks who are CNAs or nurses who are delivering really hands-on care?
Yeah, I think that will be something where it should be taken on a case by case basis. So if they are doing international travel to a place that has there is a recommendation for quarantine upon return to the U.S. or even from a state, depending on how hopefully we won't have another surge, but if there is such as Texas, where everything's come down, that may change. Right now, I'm not. I would have to look up exactly which states, but I think that would be a very reasonable thing to say, that if there's travel to certain areas that are marked by the CDC as they should be quarantining, or marked by the state of California, then that would be totally expected and reasonable to say that staff now can't just come back to work with testing. They have to complete a full quarantine period. There is the reduction now of quarantine to potentially, especially for healthcare personnel, to a 7-day testing on the 5th day, and then being able to return to work on the 7th day, as long as you remain symptom free. So if it's a real staffing crisis and you're trying to balance those things, then that might be in between to go with. For someone who may have traveled to a more high risk environment.
Is there any distinction within those guidance if a staff member has been vaccinated or has not been vaccinated?
I mean, I think, yes, the fully vaccinated would not fall into that category, because it's that now has been removed, that even if they had a known exposure to a contact, they're not required to quarantine. So this would be a hypothetical exposure in a fully vaccinated, because they were in a place where there was, a higher positivity rate. So fully vaccinated it definitely changes the game there. There may be a question when CDC first released this about fully vaccinated people no longer need to quarantine after exposure. They said, as long as they were 2 weeks out from their last dose of a series, or within 3 months of that last dose of a series. They took away the 3 months because I think there was recognition that the immunity, we don't know how long the immunity lasts, and it's probably longer than 3 months. So I think that will probably be updated in the next 4 weeks. But for right now, there isn't a time limit on that.
Okay. I want to veer back to who facilities can allow in. We've talked about family, talking about being able to give Nana and Uncle, a hug and a kiss, and we're excited. What about services like manicurists and hairstylists coming into buildings? What does that require?
Yes. So I think I tried to, I think that's the preferred way to receive those services. They are required to follow the same infection prevention and control measures within the context of providing that service. So the PPE, masking, maintaining, obviously if they're doing those personal care services, they are not going to be maintaining 6 feet of distance, but that may be some where you do require them also to provide proof of a negative test within the prior 2 days if we're in the purple tier, but obviously all the screening and symptom control. But yes, they are permitted as personnel and expected to follow all those same practices.
Okay. I want to encourage everyone, if you're having something ping for you as a question, please add it in chat and Q&A. Dr. Levin, I'm wondering if we can go back to kind of where we started this conversation, which is we talked about, again, can you just go over the new issued guidance and who that impacts, and then what the county is? And I know we've had some people chime in a little bit late, and I want to make sure everyone hears what is the new guidance and who does it impact. Okay. And then last thing on there, talk about the admission guidelines one more time.
Okay, sure. Okay, so just to review again, first, great news, we are going to be in the red tier on Sunday. So, so that's good. So any of those purple tier restrictions go away on Sunday. What has changed is that in terms of fully vaccinated healthcare personnel and residents, fully vaccinated healthcare personnel who have an exposure to a COVID case do not need to quarantine from work. Fully vaccinated residents who have an exposure to a case do need to continue to quarantine in facility because they are at higher risk for not having as robust immunity. So, so that's what's changed with in terms of the fully vaccinated visitors and fully vaccinated residents can now have physical contact with each other while maintaining masking and hand hygiene between that on their in-room visitations. So everybody should be permitted, as long as you're not in outbreak status or not in isolation or quarantine, to have in-room indoor visitation. But if they're both parties are fully vaccinated, then there can be physical contact. If they are not both fully vaccinated, then they have to maintain that 6 feet of distance and are not permitted to have physical contact. The new admission guidelines now are that fully vaccinated people coming from the community do not need to automatically be placed on a quarantine or in the yellow zone as we had been insisting before. Fully vaccinated do need to do that initial quarantine. Those fully vaccinated people who are new admits, if there is concern for exposure in the community, a known exposure, then they go along with that same guidance for the people inside the facility already, which is that a known exposure, they have to be quarantined. So that goes along in terms of the new admissions. If they're coming from a hospital, they're not fully vaccinated, then those hospital days can count towards the quarantine days as long as there was no known exposure in that hospital or in whatever the prior place of residence was.
Can you go over again what this means as it relates to red tier versus purple tier and testing for visitors within the prior 2 days? Just kind of pair that back up together for me.
Sure. So there is a requirement, guidance that if we're in purple tier, visitors should be able to provide a proof of negative COVID test within the prior 48 hours before visitation. So that is not required in the red tier. As of Sunday, that will not be a requirement. If we move back into the purple tier, then that becomes a requirement of visitation.
Okay. So can the facility, because sometimes it's hard for folks to get a test, they're driving around. Can the facility, if they have those handy dandy antigen tests, does that count as one of those tests, a negative test?
Yes, so that they can use those tests if they have them. They can request them from our Mohawk if they don't have them and want to use them. They do not need a physician order to do those tests, and they don't need to report the negative tests is what was on the state call. I know for a lot of the assisted living facilities, they don't have the capacity to do that because they don't have the CLIA waiver or people to perform them. I would say that we have wide open availability at our testing sites. Testing demand has gone way down. So there's no reason that someone trying to visit your facility, and our turnaround time is less than a day in most, like I think 80% of our tests. So, and it's like, high 90s for 2-day turnaround. So there's no reason why a visitor to your facility in Contra Costa County should not be able to procure a test free of charge within the county.
I just want to second that. I went to get my test this week on Wednesday during the lunch hour. I was literally the only person there. I have never seen it like that, in the 5-6 months we've all been testing. So I agree. County's doing a great job of making appointments available and getting you in and getting you out. So we have a question here. It's essentially saying, so what about nurses who, it says, cannot be vaccinated? Should they be required to present negative COVID tests each time they visit a resident? And I think this means outside nurse providers. So if a facility has, say, a hospice nurse that comes in from the outside, or home care, something like that, that's coming in from the outside and they're not able to be vaccinated for whatever reason, are they still presenting the COVID negative test within the prior 48 hours?
I think that seems reasonable. Yeah. I mean, again, this is in when we're in the purple tier. So that requirement sort of falls away, but if they're coming regularly, then they're part of that personnel. So for skilled nursing facilities, they should be presenting at least a weekly negative test. And for, for the assisted living facilities, at least a monthly.
Okay. And someone asked, can they use the Binax now for surveillance testing?
Yeah, I mean, so the way it was licensed is for symptomatic use, but it has been through CMS and the state, been permitted to be used as surveillance testing if you're testing frequently. That its sensitivity goes up and specificity goes up with that more frequent testing schedule. Okay.
So, Dr. Levin, we've got 2 days left in the purple tier, and we're moving on to the beautiful and glorious red tier. And this guidance just came out for skilled nursing. We're still waiting on it for Department of Social Services. We think it's going to mirror pretty closely.
Yeah.
This just hit out, it just came out this week. And for 12 months, these facilities have been on the front lines of this. And I'm guessing there's some thoughts on, oh my gosh, the outside world is coming.
Yeah.
So are these guidance, is they in action right now, or do facilities have a few days to get their systems in place?
I think they are effective immediately, but I also, I think that that the facility, I'm not aware that the facilities are required to present a plan or their visitation policies are put in place through any of the regulatory sort of demand. So I would say, really should be just working on what your implementation looks like. I mean, you already have done quite a bit of work to your visitation policies when these the state policy came out last fall that mandated indoor visitation must be made available when you're not in outbreak status. So I would think it's getting those just tuned up with these new changes that allow for a little bit more robust scheduling and visitation and communication with the families around what your timeline is anticipated.
Mm-hmm.
I have a sort of question. I think this is a discussion that we were having, and which is, I know a lot of these facilities have their independent living sides, and then they're more assisted living, and and so it may become confusing for those, do the independent living side fall under more the general public guidance and are not under this? And my understanding is that would not be true because of the regulatory infrastructure.
Mhm. And so if a facility writes up a plan and they're just wanting some extra, feedback, can they contact you and your team to say like, Dr. Levin, does this make sense? Does this wash with you? Is that okay?
Yeah, definitely.
Okay. I just think this is a lot about sort of understanding that telling your family, I think a lot of open communication now, telling your families, look, we got this new regulation as soon as you did. We're working on our policies. I think now, like the last 12 months, more communication is better than less. Let them know what your scheduling process is going to be. Talk to them about how they can get help and assistance and what you're doing to make sure they'll be able to connect with their family member as soon as possible and as regularly as possible.
Yeah, and I think what you may be getting bombarded with families from is that that distinction between what is the guidance for general public versus for these facilities that are under regulatory guidance. So I hope that you are able to put out some communication to your families that make that clear so that you're not getting bombarded with demands for unmasked in apartment and room visitation.
Right. So with that, I want to remind everyone that as the CDSS guidance comes out, we'll of course share that with you and you guys can see that all on their website. We've recorded this webinar and we will provide it to everyone who registered along with the updated AFL so you can see that. We'll also be sharing with you a link that I hope you will provide to your family members, which is we're going to be doing a webinar for family members next Wednesday evening at 6 p.m. Essentially really trying to help you and explain these are actually what the guidelines are and how it differs from the general public. So you will get all of that on Monday. We really appreciate all of your work over the last year. Please reach out to Dr. Levin or the Ombudsman office if you have follow-up and questions. We know the pandemic is not over, and so we're going to keep communicating with you as frequently as possible. Dr. Levin, thank you so much for all of your work that you've done over the last year. We really appreciate it, and we really appreciate the information today.
My pleasure. Thank you all for doing so much to take care of our elders of our community. I know what a rough year it has been, and it's just been such an inspiration to me every day to see how diligently and warm-heartedly you have stepped up to do the work that we've needed to do to keep our community members safe. So thank you.
Excellent. Everyone have a good weekend. Get some good rest.